Welcome to 24 Cares. I'm Devin Owens-Teller, leader of operations and analytics at Cares by KJE.
And I'm Annalise Alamo, culture transformation leader.
We are a tech-enabled strategy and leadership development firm specializing in diversity, equity, and inclusion. We are back with Leonor Marquez, CEO of LBU Community in South Dallas. Welcome back, Leonor.
Thank you. Really happy to be here.
Yes, happy to have you.
All right, so in our part one, we talked a little bit about speaking the same language and building relationships. We want to dig a little bit deeper in that kind of topic. So how do language and bilingual communication support health equity for populations where English is not the first language?
Oh, that's such a good question, Devin. Relationship, I think, is paramount, is the most important thing, but a very close second is language and the ability to understand each other. That's literally the same language. It's also the level, okay? I've got a pretty decent command of the Spanish language, but if the chips are down, if I'm sick, if I'm in a foreign land, if I'm alone, and then everyone speaks a different language, and quite frankly, in most large metropolitan cities around the world, you're going to find some English speakers. However, if you're in a situation where you're not feeling good, you're afraid, you're worried, you're going to want to speak your native tongue, and you want the person who's attending to you you want to make sure that they understand you. So I think it's everything. It's so easy, the nuances of language and culture, it's so easy to be misunderstood, and it can take you in a different direction for treatment. So I think it's really, really important to be understood.
Yeah, even thinking just as an English speaker going to the doctor and trying to understand the medical terms around, what I'm dealing with or diagnosed with, I can only imagine, what those barriers or experiences might feel like if I don't speak English, as a first language as well.
Yeah.
And also, if you're intimidated by the setting, which culture, and if it's a different culture and a different language, it can create that. And especially if you're feeling rushed, or if the doctor's feeling rushed, it's going to be even harder to get to be understood. Yeah. And at some point, it's going to be more important to get out of the room, to get out of that intimidating situation. That is what we don't want. Yeah. That is what we want. We really strive to understand our patients. And quite frankly, know when we're not understanding, so that we can try something else.
That's good.
It reminds me of, so we took a trip in Europe when my older daughter was very young, and she got sick during the trip, and we had to take her to an emergency room in some remote town in Italy, not the city, and we had to do sign language because, to try to describe to the doctor what the symptoms were, but we just didn't understand each other. The medication prescribed ended up making her more sick, and so we had to fly home. So totally understand the importance of communication and that language barrier can be a big deal.
You're professional, you're worldly, you've got a good insurance, and it was still very scary and intimidating.
Absolutely.
You're very vulnerable.
Absolutely.
Yes,
I get
that's
it.
a good point.
I'm glad she's better.
Yes. I was like, a long time ago, but yes.
Yes. So along that same vein, how equipped are medical professionals and offices to provide bilingual services in 2022?
Devin, good question. I think we're probably better than we've ever been. We being the healthcare profession in Texas, I think Texas cities, we're going to have clinics and hospitals that have Spanish-speaking staff. Again, language isn't everything. It's culture as well. But even if you've got, say, a medical assistant who speaks beautiful Spanish, does he or she have the skills to be a respectful interpreter? Does she know where to, does the physician and the medical assistant know how to help the patient? Do they adopt that triangular stance so that they're all kind of on equal footing? And that, is there still good eye contact with the healer and the patient? I mean, there's some pretty simple techniques that we can teach. So the language isn't it's how you interpret, it's the respect, it's the not necessarily word per word, but I know what the doctor's trying to say. Let me say it like this. It's really, again, really striving to be understood and communicating very, very clearly so that the patient understands.
Yeah, that's so good. So where do you feel like the gaps are, and how can we improve in this area? And you talked a little bit about the training and the techniques that we can kind of provide. Is there anything else you'd like to add on that?
The gaps, again, just striving to understand who our customers are is just super important. And I know at LBU Community Clinic, we're on the DEI training journey. It's a journey. It's not a destination. It's not a one and done. And what I'm learning is that early on, you just get to the point when you're starting that you just get a sense of how much you don't know. And that's rough. It's a little daunting sometimes. It's like, oh my goodness.
Yeah.
And you sort of cringe a little bit when you think about, oh, I missed the boat back then with a friend, with a neighbor, with a family member, with a patient. So it's uncomfortable, trying to fill those gaps, trying to bridge the gaps, because you want to get smarter, you want to get more enlightened. But as you're beginning the process, it's, oh my goodness, how much I don't know. And the world gets bigger in a way early on that's very daunting.
Yeah. And I remember, I don't know if you remember, we're actually 2 years from when we first started.
I do. It has
DEI
been 2
training
years.
journey.
That's right. Yes.
And we had the similar conversation after doing that first session with the leadership team around
I remember.
the daunting and the uncomfortable. But
Yes.
but you as leader leaning into that and saying, yes, it's uncomfortable, but we still need to do it.
Yes, it's uncomfortable, but this is safe.
Yes.
And it's okay.
Yes.
And let's get smarter. Let's get more enlightened. Let's learn more.
Yeah.
Kind of cringe, but let's get over ourselves. Move forward.
Yes. I think that's the humility part of this work too. I mean, we are consultants and experts in the space, but we're also learning something new every day as the world evolves. So there's different situations that still force us to pause and say, how do we communicate and be inclusive in this situation, right? And so it's constantly evolving, which I think we're all in that same field. Everyone's just starting at different points in their journey. So speaking of education and DEI education in particular, how is that impacting the medical community, serving the broader population? Is it effective with both internal employees as well as how they're translating that into patient care?
So we feel like we're in the early steps of the DEI journey. In some respects, we've been very diverse, right, since the beginning. We have been very good at LBU at taking care of the working poor Latino population. We're learning about other cultures, and we're humble enough to know that that people are different and that we don't know everything. So how is it going? It's slowly, but we're seeing some I guess more enlightened conversations and more open conversations. We used to sort of accept that or not accept the differences, but put up with them. Now we're appreciating the differences. It used to be that we celebrate differences by a Cinco de Mayo day or it's really not about that. It's about understanding each other and what makes us tick. And that kind of progress I've really enjoyed seeing. I've enjoyed seeing how that's rolling out with my staff and interacting with patients as well.
That's great. And I know that in the sessions that at least I know I've been involved with and facilitated for your team, it's been that kind of feedback as well about appreciating the investment in them to have this training, because it's again, self-awareness, self-development for them, but it does translate into the work that they do, thus impacting your patients, right?
It does. And so if I were to approach the average employee and say, we got some training for you, they're going to, sometimes they're going to roll their eyes and grit their teeth and but then as they get into it, especially when we can apply it to the work they're doing, they do come to appreciate it. They really do. They get through the discomfort. They get through all of that. We provide the training. You guys have provided training literally in their language, and I really do appreciate that. It makes a huge difference. So, and it's a journey. Like I said, it's not a one and done. It's a journey of learning and understanding more.
Yeah, and I'm glad you said that. I know you said that earlier as we were talking about, this is a journey. It's going to continue to evolve. It's not a destination. We're going to continue to go towards that, and it is not just a check the box activity, right? Because it is continuing to evolve. So just because you learn something now doesn't mean you're not going to learn something new as we continue to learn in this space every day.
That's right.
Yeah. So how do you see, I guess, the employees that have participated in the training so far, how do you see them beginning to kind of bring those nuggets of information or of learning, enlightenment kind of to their patient interactions or the check-in interactions at the front desk?
I see, actually I see it in each other. Okay, I see it with how they relate to each other. And that's been a beautiful thing.
Yeah.
We really do want to celebrate differences, not just put up with people that are different from us. That's a very different orientation, and I see that evolution happening. It's been very nice to see, and I also see it with patients. We know pretty quickly when we miss the mark, and we're hope to get better and better at pivoting and kind of correcting as we go. And that, again, it's a journey. It's not something you learn right away. It's almost like those early steps. You're sort of learning how wrong you are sometimes, or how kind of how you've taken a wrong turn. But again, it's something that we're just going to get better and better as we practice and learn about other cultures, learn more.
Yeah, that's so good. And I think there's so much grace in the fact that because the entire organization is going through the same journey relatively at the same time, they can really like lean on one another when someone does make a misstep. They can go and say, hey, this happened. What do you think about it? How should I handle it next time? And really kind of debrief with someone that understands kind of where they are in the journey.
Absolutely. And in a safe environment.
Yes.
Previously it would have been kind of scary. And what do you mean by that? And I didn't mean and now it's like, oh gosh, okay, yeah, I get that.
Yeah.
I see what you mean, Mel.
Yeah.
And that learning, the empathy is a big thing too, and grace, as Devin said, that translates into patient care because your patients are also going to be coming from different backgrounds and journeys in that D&I space, and they're not always going to be in the same level or the same understanding. So we have to, on our side, because we are educated, maybe more aware in some situations, have to extend that grace.
That's right. That's right. Absolutely. Yeah. I think the burden, if you will, is on us, the healthcare community, to understand them, not you understand. Because in the old days, it used to be, you better understand the doctor, and you better respect the doctor, and you better. But the burden, I really feel like, is on the healthcare team and the leadership, the organization, to provide the right training and resources to effectively connect with patients.
Yeah, that's good. Well, thanks for joining us again, Leonor. This has been a wonderful conversation. And stay tuned. Thank you for joining and tuning in to 24 Caris. We help you live a 24/7 commitment to DEI 365 days of the year.